What if I told you that the stomach acid medication you're taking for heartburn is actually causing the problem it's supposed to solve? That your doctor learned virtually nothing about nutrition despite spending 8 years in medical school? That the very system claiming to heal you was deliberately designed over 100 years ago by an oil tycoon, John D Rockefeller, to create lifelong customers, not healthy people? Last week, a patient spent thousands of dollars on tests and treatments for acid reflux, only to discover she needed more stomach acid, not less. The medication keeping her sick was designed to do exactly that. Today, we're exposing the greatest medical deception in modern history: how a petroleum empire systematically destroyed natural healing wisdom, turned medicine into a profit machine, and why the treatments keeping millions sick were engineered that way from the beginning. This isn't about conspiracy theories. This is a documented history that explains why you feel so lost about your own body's needs. Welcome back to Let's Talk Wellness Now, the show where we uncover the root causes of chronic illness, explore cutting-edge regenerative medicine, and empower you with the tools to heal. I'm Dr. Deb, and today we're diving into how the Rockefeller medical empire systematically destroyed natural healing, wisdom, and replaced it with profit-driven systems that keeps you dependent on treatments instead of achieving true health. If you or someone you love has been running to the doctor for every minor ailment, taking acid blockers that seem to make digestive problems worse, or feeling confused about basic body functions that our ancestors understood instinctively, this episode is for you. So as usual, grab a cup of coffee, tea, or whatever helps you unwind, settle in, and let's get started on your journey to reclaiming your health sovereignty. All right, so here we are talking about the Rockefeller medical revolution. Now, what if your symptoms aren't true diagnosis, but rather the predictable result of a medical system designed over 100 years ago to create lifelong customers instead of healthy people? Now, I learned this when I was in naturopathic school over 20 years ago, and it hasn't been talked about a lot until recently. Recently, people are exposing the truth about what actually happened in our medical system. And today, I want to take you back to the early 1900s to understand how we lost the basic health wisdom that sustained humanity for thousands of years. Yes, I said that, thousands of years. This isn't conspiracy theory. This is documented history that explains why you feel so lost when it comes to your own body's needs. You know, by the turn of the 20th century, according to Meridian Health Clinic's documentation, Rockefeller controlled 90% of all petroleum refineries in America, and through ownership of the Standard Oil Corporation. But Rockefeller saw an opportunity that went far beyond oil. He recognized that petrochemicals could be the foundation for a completely new medical system. And here's what most people don't know. Natural and herbal medicines were very popular in America during the early 1900s. According to Stawell Copper's historical analysis, almost 1/2 of medical colleges and doctors in America were practicing holistic medicine, using extensive knowledge from Europe and Native American traditions. People understood that food was medicine, that the body had natural healing mechanisms, and that supporting these mechanisms was the key to health. But there was a problem with the Rockefellers' business plan. Natural medicines couldn't be patented. They couldn't make a lot of money off of them because they couldn't hold a patent. Petrochemicals, however, could be patented, could be owned, and could be sold for high profits. So Rockefeller and Andrew Carnegie devised a systematic plan to eliminate natural medicine and replace it with petrochemical-based pharmaceuticals. And according to E. Richard Brown's comprehensive academic documentation in Rockefeller Medicine Men, Medicine and Capitalism in America, they employed the services of Abraham Flexner, who proceeded to visit and assess every single medical school in US and in Canada. Within a very short time of this development, medical schools all around the US began to collapse or consolidate. Numbers are staggering. By 1910, 30 schools had merged and 21 had closed their doors. Of the 166 medical colleges operating in 1904, 133 had survived by 1910 and 104 by 1915. 15 years later, only 76 schools of medicine existed in the US, and they all followed the same curriculum. This wasn't just about changing medical education. According to Staywell's Copper Historical Analysis, Rockefeller and Carnegie influenced insurance companies to stop covering holistic treatments. Medical professionals were trained in the new pharmaceutical model, and natural solutions became outdated or forgotten. Not only that, alternative healthcare practitioners who wanted to stay practicing in alternative medicine were imprisoned for doing so. As documented by the potency number 710, the goal was clear: create a system where scientists would study how plants cure disease, identify which chemicals in the plants were effective, and then recreate a similar but not identical chemical in the laboratory that would be patented. E. Richard Brown's documents the story of how a powerful professional elite gained virtual hegemony in the Western theater of healing by effectively taking control of the ethos and practice of Western medicine. The result, according to the healthcare spending data, the United States now spends 17.6% of its GDP on healthcare, $4.9 trillion in 2023, or $14,570 per person, nearly twice as much as the average OECD country. But it doesn't focus on cure, but on symptoms, and thus creating recurring clients. This systematic destruction of natural medicine explains why today's healthcare providers often seem baffled by simple questions about nutrition, why they immediately reach for a prescription medication for minor ailments, and why so many people feel disconnected from their own body's wisdom. We've been trained over 4 generations to believe that our bodies are broken and that symptoms are diseases rather than messages, and that external interventions are always superior to supporting natural healing processes. But here's what they couldn't eliminate: your body's innate wisdom. Your digestive system still functions the same way it did 100 years ago. Your immune system still follows the same patterns. The principles of nutrition, movement, and stress management haven't changed. We've just forgotten how to listen and respond. We're going to take a small break here and hear from our sponsor. When we come back, we're going to talk about the acid reflux deception and why your cure is making you sicker. So don't go away. Ladies, it's time to reignite your vitality. Primal Queen supplements are clean, powerful formulas made for women like you who want balance, strength, and energy that lasts. Get 25% off at primalqueen.com/Serenity Health. That's primalqueen.com/Serenity Health, because every queen deserves to feel in her prime. All right, welcome back. So I want to give you a perfect example of how Rockefeller medicine has turned natural body wisdom upside down: the treatment of acid reflux and heartburn. Every single day in my practice, I see patients who've been taking acid blocker medications, proton pump inhibitors like Prilosec, Nexium, or Prevacid for years, not for weeks, years, and sometimes even decades. They come to me because their digestive problems are getting worse, not better. They have bloating and gas and nutrition deficiencies, and we're seeing many more increased food sensitivities. And here's what's happening. In the US, most people often attribute their digestive problems to too much stomach acid, and they use medications to suppress the stomach acid. But in fact, symptoms of chronic acid reflux, heartburn, or GERD can also be caused by too little stomach acid, a condition called hypochlorhydria. Normal stomach acid has a pH level of 1 to 2, which is highly acidic. Hydrochloric acid plays an important role in your digestion and your immunity. It helps to break down proteins and absorb essential nutrients, and it helps control viruses and bacteria that might otherwise infect your stomach. But here's the crucial part that most people don't understand. And according to Cleveland Clinic, your stomach secretes lower amounts of hydrochloric acid as you age. Hypochlorhydria is more common in people over the age of 40 and even more common over the age of 65. WebMD states that the stomach acid can produce less acid as a result of aging, and being 65 or older is a risk factor for developing hypochlorhydria. We've been treating this in my practice for a long time. It's one of the main foundations that we learn as naturopathic practitioners and as naturopathic doctors. And there are times where people need these medications, but they were designed to be used short-term, not long-term. In a 2013 review published in Medical News Today, they found that hypochlorhydria is the main change in the stomach acid of older adults. And when you have hypochlorhydria, poor digestion from the lack of stomach acid can create gas bubbles that rise into your esophagus or throat, carrying stomach acid with them. You experience heartburn and assume that you have too much acid. So you take acid blockers, which makes the underlying problem worse. Now, here's something that will shock you. PPIs, protein pump inhibitors, were originally studied and approved by the FDA for short-term use only. According to research published in US Pharmacist, most cases of peptic ulcers resolve in 6 to 8 weeks with PPI therapy, which is what these medications were created for originally. The American Family Physician reports that for erosive esophagitis, omeprazole is indicated for short-term, 4 to 8 weeks. That's it. Treatment and healing and done. If needed, an additional 4 to 8 weeks of therapy may be considered. And the University of Minnesota College of Pharmacy states guidelines recommended a treatment duration of 8 weeks with standard once-a-day dosing for a PPI for GERD. The Canadian Family Physician published guidelines where a team of healthcare professionals recommended prescribing PPIs in adults who suffer from heartburn and who have completed a minimum treatment of 4 weeks in which symptoms were relieved. Yet people are taking these medications for years, even decades, far beyond their intended duration of use. And a study published in PMC found that the threshold for defining long-term PPI use varied from 2 weeks to 7 years of PPI use. But most common definition was greater than 1 year or 6 months. According to the research in clinical context, use of PPIs for more than 8 weeks could be reasonably defined as long-term use. Now let's talk about what these acid blocker medications are actually doing to your body when used long-term. The research on long-term PPI use is absolutely alarming. According to the comprehensive review published in PubMed Central, PMC, long-term use of PPIs have been associated with serious adverse effects, including kidney disease, cardiovascular disease, fractures because you're not absorbing your nutrients and you're being depleted, infections including C. diff, pneumonia, micronutrient deficiencies, and hypomagnesemia, a low level of magnesium, anemia, vitamin B deficiency, hypocalcemia, low calcium, low potassium, and even cancers including gastric cancer, pancreatic cancer, colorectal cancer, and hepatic cancer. And we are seeing all of these cancers on a rise, and we are now linking them back to some of these medications. Mayo Clinic proceedings published research showing that recent studies regarding long-term use of PPI medication have noted potential adverse effects, including risks of fracture, pneumonia, C. diff, which is a diarrhea, it's a bacteria, low magnesium, low B12, chronic kidney disease, and even dementia. And a 2024 study published in Nature Communications analyzing over 2 million participants from 5 cohorts found that PPI use correlated with increased risk of 15 leading global diseases, such as ischemic heart disease, diabetes, respiratory infections, chronic kidney disease. And these associations showed dose response relationships and consistency across different PPI types. Now, think about this. You take a medication for heartburn that was designed for 4 to 8 weeks of use. And when used long term, it actually increases your risk of life-threatening infections, kidney disease, and dementia. This is the predictable result of suppressing a natural body function that exists for important reasons. HCI plays a key role in many physiological processes. It triggers intestinal hormones, prepares folate and B12 for absorption, and it's essential for absorption of minerals, including calcium, magnesium, potassium, zinc, and iron. And when you block acid production, you create a cascade of nutritional deficiencies and immune system problems that often manifest as seemingly unrelated health issues. So, what's the natural approach? Instead of suppressing stomach acid, we need to support healthy acid production and address the root cause of reflux. Healthcare providers may prescribe HCl supplements like betaine hydrochloric acid. BHCl is what it's called. Sometimes it's called betaine. It's often combined with enzymes like pepsin or amylase or lipase, and it's used to treat hydrochloric acid deficiency, hypochlorhydria. These supplements can help your digestion and sometimes help your stomach acid gradually return back to normal levels, where you may not need to use them all the time. Simple strategies include consuming protein at the beginning of the meal to stimulate HCl production. Consume fluids separately, at least 30 minutes away from meals if you can, and address the underlying cause like chronic stress and H. pylori infections. This is such a sore subject for me. So many people walk around with an H. pylori infection. It's a bacterial infection in the stomach that can cause stomach ulcers, causes a lot of stomach pain and burning, and nobody is treating the infection. It's a bacterial infection. We don't treat this anymore with antibiotics or antimicrobials. We treat it with PPIs, but PPIs don't fix the problem. You have to get rid of the bacteria. Once the bacteria is gone, the gut lining can heal. Now, it is a common bacteria. It can reoccur quite frequently. It's highly contagious, so you can pick it up from other people. And it may need multiple courses of treatment over a person's lifetime. But you're actually treating the problem. You're getting rid of the bacteria that's creating the issue instead of suppressing the acid that's not fixing the bacteria, which then leads to a whole host of other problems that we just talked about. There are natural approaches to increase stomach acid, including addressing zinc deficiency. And since the stomach uses zinc to produce HCl, taking probiotics to help support healthy gut bacteria and using digestive bitters before meals can be really helpful. This is exactly what I mean about reclaiming the body's wisdom. Instead of suppressing natural functions, we support them. Instead of creating drug dependency, we restore normal physiology. Instead of treating symptoms indefinitely, we address the root cause and help the body heal itself. In many cultures, bitters is a common thing to use before or after a meal. But yet in the American culture, we don't do that anymore. We've not passed on that tradition. So very few people understand how to use bitters or what bitters are or why they're important. And these basic things that can be used in your food and cooking and taking could replace thousands of dollars of medication that you don't really need that can create many more problems along the way. Now, why does your doctor know nothing about nutrition? Well, I want to address something that might shock you all. The reason your doctor seems baffled when you ask about nutrition isn't because they're not intelligent. It's because they literally never learned this in medical school. Statistics on nutritional education in medical schools are staggering and help explain why we have such a health literacy crisis in America. According to recent research published in multiple academic journals, only 27% of US medical schools actually offer students the recommended 25 hours of nutritional training across 4 years of medical school. That means 73% of the medical schools don't even meet the minimum standards set in 1985. But wait, it gets worse. A 2021 survey of medical schools in the US and the UK found that most students receive an average of only 11 hours of nutritional training throughout their entire medical program. And another recent study showed that in 2023, a survey of more than 1,000 US medical students, about 58% of these respondents said they received no formal nutritional education while in medical school for 4 years. Those who did averaged only 3 hours. I'm going to say this again because it's huge. 3 hours of nutritional education per year. So let me put this in perspective. During 4 years of medical school, most students spend fewer than 20 hours on nutrition. That's completely disproportionate to its health benefits for patients. To compare, they'll spend hundreds of hours learning about pharmaceutical interventions, but virtually no time learning how food affects health and disease. Now, could this be why, when we talk about nutrition to lower cholesterol levels or control your diabetes, they blow you off and they don't answer you? It's because they don't understand. But yet what they'll say is people won't change their diet. That's why you have to take medication. That's not true. I will tell you, I work with people every single day who are willing to change their diet. They're just confused by all the information that's out there today about nutrition and what diet is the right diet to follow. Do I do paleo? Do I do AIP? Do I do carnivore? Do I do keto? Do I do low carb? There's so many diets out there today, it's confusing people. So I digress, but let's go back. So here's the kicker. The limited time medical students do spend on nutrition often focuses on nutrients, think proteins and carbohydrates, rather than training in topics such as motivational interviewing or meal planning. And as one Stanford researcher noted, we physicians often sound like chemists rather than counselors who can speak with patients about diet. Isn't that true? We can speak super high level up here, but we can't talk basics about nutrition. And this explains why only 14% of the physicians believe they were adequately trained in nutritional counseling once they entered practice. And without foundational concepts of nutrition in undergrad work, graduate medical education, unsurprisingly, falls short of meeting patients' needs for nutritional guidance in clinical practice. And meanwhile, diet-sensitive chronic diseases continue to escalate, although they are largely preventable and treatable by nutritional therapies and dietary lifestyle changes. Now think about this. Diet-related diseases are the #1 cause of death in the US. The #1 cause. Yet many doctors receive little to no nutritional education in medical school. And according to current health statistics from 2017 to March of 2020, obesity prevalence was 19.7% among US children and adolescents, affecting approximately 14.7 million young people. About 352,000 Americans under the age of 20 have been diagnosed with diabetes. Let me say this again, because these numbers are astounding to me. 352,000 Americans under the age of 20 have been diagnosed with diabetes, with 5,300 youth diagnosed with type 2 diabetes annually. Yet the very professionals we turn to for health guidance were never taught how food affects these conditions. And what drug has come to the rescue? GLP-1s, Ozempic, Wegovy. They're great for weight loss. They're great for treating diabetes. But why are they here? Well, these numbers are why they're here. This is staggering. To put 352,000 Americans under the age of 20 on a GLP-1 that they're going to be on for the rest of their lives at a minimum of $1,200 per month. All we have to do is do the math, you guys. And we can see exactly what's happening to our country and who is getting rich and who is getting the short end of the stick. You've become a moneymaker to the pharmaceutical industry because nobody has taught you how to eat properly, how to live, how to have a healthy lifestyle, and how to prevent disease, or how to actually reverse type 2 diabetes, because it's reversible in many cases, especially young people. And we do none of that. All we do is prescribe medications, metformin, GLP-1, for the rest of your life. From 20 years old to 75 or 80, you're going to be taking medications that are making the pharmaceutical companies more wealthy and creating a disease on top of a disease on top of a disease. These deficiencies in nutritional education happen at all levels of medical training, and there's been little improvement despite decades of calls for reform. In 1985, the National Academy of Sciences report that they recommended at least 25 hours of nutritional education in medical school, but a 2015 study showed only 29% of medical schools met this goal. And a 2023 study suggests the problem has become even worse. Only 7.8% of medical students reported 20 or more hours of nutritional education across all 4 years of medical school. This systemic lack of nutritional education, has been attributed to several factors: a dearth of qualified instructors for nutritional courses, since most physicians do not understand nutrition well enough to teach it; competition for curriculum time, with schools focusing on pharmaceutical interventions rather than lifestyle medicine; and a lack of external incentives that support schools teaching nutrition. And ironically, many medical schools are part of universities that have nutrition departments with PhD trained professors who could fill this gap by teaching nutrition in medical schools. But those classes are often taught by physicians who may not have adequate nutritional training themselves. This explains so much about what I see in my practice. Patients come to me confused and frustrated because their primary care doctors can't answer basic questions about how food affects their health conditions. And these doctors aren't incompetent. They simply were never taught this information. And the result is that these physicians graduate knowing how to prescribe medications for diabetes, but not how dietary changes can prevent or reverse it. They can treat high blood pressure with pharmaceuticals, but they may not know that specific nutritional approaches can be equally or more effective. This isn't the doctor's fault. It's the predictable result of medical education systems that was deliberately designed to focus on patentable treatments rather than natural healing approaches. And remember, this traces back to the Rockefeller influence on medical education. You can't patent an apple or a vegetable, but you can patent a drug. Now, why can't we trust most medical studies? Well, this just gets even better. I need to address something that's crucial for you to understand as you navigate health information. Why so much of the medical research you hear about in the news is biased, and why peer review isn't the gold standard of truth you've been told it is. The corruption in medical research by pharmaceutical companies is not a conspiracy theory. It's well-documented scientific fact. According to research published in Frontiers in Research Metrics and Analytics, when pharmaceutical and other companies sponsor research, there is a bias, a systematic tendency towards results serving their interests. But the bias is not seen in the formal factors routinely associated with low-quality science. A Cochrane review analyzed 75 studies of the association between industry funding and trial results. And these authors concluded that trials funded by a drug or a device company were more likely to have positive conclusions and statistically significant results. and that this association could not be explained by differences in risk of bias between industry and non-industry funded trials. So think about that. According to the Cochrane collaboration, industry funding itself should be considered a standard risk of bias, a factor in clinical trials. Studies published in Science and Engineering Ethics show that industry-supported research is much more likely to yield positive outcomes than research with any other sponsorship. And here's how the bias gets introduced through choice of comparator agents, multiple publications of positive trials, and non-publication of negative trials. Reinterpreting data submitted to regulatory agencies, discordance between results and conclusions, conflict of interest leading to more positive conclusions, ghostwriting, and the use of seeding trials. Research published in the American Journal of Medicine found that a result favorable to drug study was reported by all industry-supported studies, compared with 2/3 of studies not industry supported. All industry supported studies showed favorable results. That's not science. That's marketing masquerading as research. And according to research published in Science Direct, the peer review system, which we're told ensures quality science, has a major limitation. It has proved to be unable to deal with conflicts of interest, especially in big science, contexts where prestigious scientists may have similar biases and conflicts of interest are widely shared among peer reviewers. Even government-funded research can have conflicts of interest. Research published in PubMed states that there are significant benefits to authors and investigators in participating in government-funded research and to journals in publishing it, which creates potentially biased information that are rarely acknowledged. And according to research published in Frontiers in Research Metrics and Analytics, the pharmaceutical industry has essentially co-opted medical knowledge systems for their particular interests. Using its very substantial resources, pharmaceutical companies take their own research and smoothly integrate it into medical science, taking advantage of the legitimacy of medical institutions. And this corruption means that much of what passes for medical science is actually influenced by commercial interests rather than pursuant of truth. Research published in PMC shows that industry funding affects the results of clinical trials in predictable directions, serving the interests of the funders rather than the patients. So where can we get this reliable, unbiased health information? Because this is critically important because your health decisions should be based on the best available evidence, not marketing disguised as science. And so here are some sources that I recommend for trustworthy health and nutritional information. They're independent academic sources according to Harvard Chan School of Public Health. They're nutritional sourced, implicitly states their content is free from industry, influence, or support. The Linus Pauling Institute Micronutrient Information Center at Oregon State University, which according to the Glendale Community College Research Guide provides scientifically accurate information about vitamins, minerals, and other dietary factors. This institute has been around for decades. I've used it a lot. I've gotten a lot of great information from them. Very, very trustworthy. According to the Glendale Community College of Nutrition Resource Guide, Tufts University of Human Nutritional Research Center on Aging is one of 6 human nutrition research centers supported by the United States Department of Agriculture, the USDA. They're peer-reviewed journals with strong editorial independence, though you must still check funding resources. And how do you evaluate this information online? Well, according to Medline Plus and various health literacy guides, when evaluating health information, medical schools and large professional or nonprofit organizations are generally reliable sources, but remember, it is tainted by the Rockefeller method. So, for example, the American College of Cardiology, excuse me, professional organization, and the American Heart Institute, a nonprofit, are both reliable sources, sorry about that, of information on heart health. And watch out for ads designed to look like neutral health information. If the site is funded by ads, They should be clearly marked as advertisements. Excuse me. I guess I'm talking just a little too much now. When the fear of medicine becomes deadly, now I want to address something critically important that often gets lost in conversations about health sovereignty and questioning the medical establishment. And while I've spent most of this episode explaining how the Rockefeller medical system has created dependency and suppressed natural healing wisdom, there's a dangerous pendulum swing happening that I see in my practice. People becoming so fearful of pharmaceutical interventions that they refuse life-saving treatments when they're genuinely needed. This is where balance and clinical judgment become absolutely essential. Yes, we need to reclaim our basic health literacy and reduce our dependency on unnecessary medical interventions. But there are serious bacterial infections that require immediate antibiotic treatment, and the consequences of avoiding treatment can be devastating or even fatal. So let me share some examples from research that illustrate when antibiotic fear becomes dangerous. Let's talk about Lyme disease and when natural approaches might not be enough. The International Lyme Disease Association, ILADS, has conducted extensive research on chronic Lyme disease, and their findings are sobering. ILADS defines chronic Lyme disease as a multi-system illness that results from an active and ongoing infection of pathogenic members of Borrelia burgdorferi complex. And according to ILADS research published in their treatment guidelines, the consequences of untreated persistent Lyme infection far outweigh the potential consequences of long-term antibiotic therapy. In well-designed trials of antibiotic retreatment in patients with severe fatigue, 64% in the treatment arm obtained clinically significant and sustained benefit from additional antibiotic therapy. ILADS emphasizes that cases of chronic Borrelia require individualized treatment plans, and when necessary, antibiotic therapy should be extended. Their research demonstrates that 20 days of prophylactic antibiotic treatment may be highly effective for preventing the onset of Lyme disease after known tick bites, and patients with early Lyme disease may be best served by receiving 4 to 6 weeks of antibiotic therapy. Research published in PMC shows that patients with untreated infections may go on to develop chronic debilitating multi-system illnesses that is difficult to manage. And numerous studies have documented persistent Borrelia burgdorferi infection in patients with persistent symptoms of neurological Lyme disease following short-course antibiotic treatment. And animal models have demonstrated that short-course antibiotic therapy may fail to eradicate Lyme spirochetes. Short course is a 1-day, 1-pill treatment of doxycycline, or less than 20 days of antibiotics is considered a short course. It's not long enough to kill the bacteria. The bacteria's life cycle is about 21 days. So if you don't treat the infection long enough, the likelihood of that infection returning is significant. They've also done studies in the Petri dish where they show doxycycline being put into a Petri dish with active Lyme, and doxycycline does not kill the infection. It just slows the replication of it. Therefore, using only doxycycline, which is common practice in Lyme disease, may not completely eradicate that infection for you. So let's talk about another life-threatening emergency, C. diff, Clostridia difficile infection, which represents another example where antibiotic treatment is absolutely essential, despite the fact that C. diff itself is often triggered by antibiotic use. According to Cleveland Clinic, C. diff is estimated to cause almost 500,000 infections in the United States each year, with 500,000 infections causing 15,000 deaths each year. Studies reported by PMC found 30-day CDI mortality rates ranging from 6 to 11%, and hospitalized CDI patients have significantly increased the risk of mortality and complications. Research published in PMC shows that 16.5% of CDI patients experience sepsis, and that this increases with reoccurrences. 27.3% of patients with their first reoccurrence experience sepsis, while 33.1% with 2 reoccurrences, and 43.2% with 3 or more reoccurrences. Mortality associated with sepsis is very high, with in-hospital 30 days and 12-month mortality rates of 24%, 30%, and 58%, respectively. According to the CDC, treatment for C. diff infection usually involves taking a specific antibiotic, such as vancomycin, for at least 10 days. And while this seems counterintuitive, treating an antibiotic-associated infection with more antibiotics, it's often life-saving. Now let's talk about preventing devastating complications. Strep throat. Strep throat infections provide perhaps the clearest example of when antibiotic treatment prevents serious long-term consequences. And according to Mayo Clinic, if untreated, strep throat can cause complications such as kidney inflammation and rheumatic fever. Rheumatic fever can lead to painful and inflamed joints and a specific type of rash of heart valve damage. We also know that strep can cause pans pandis, which is a systemic infection, often causing problems with severe OCD and anxiety and affecting mostly young people. The research is unambiguous. According to the Cleveland Clinic, rheumatic fever is a rare complication of untreated strep throat or scarlet fever that most commonly affects children and teens, and in severe cases, it can lead to serious health problems that can affect your child's heart, joints, and organs. And research also shows that the rate of development of rheumatic fever in individuals with untreated strep infections is estimated to be 3%. The incidence of reoccurrence with a subsequent untreated infection is substantially greater, about 50%. The rate of development is far lower in individuals who have received antibiotic treatment. And according to the World Health Organization, rheumatic heart disease results from the inflammation and scarring of the heart valves caused by rheumatic fever. And if rheumatic fever is not treated promptly, rheumatic heart disease may occur. And rheumatic heart disease weakens the valves between the chambers of the heart. And severe rheumatic heart disease can require heart surgery and result in death. The WHO states that rheumatic heart disease remains the leading cause of maternal cardiac complications during pregnancy. And additionally, according to the National Kidney Foundation, after your child has either had throat or skin strep infection, they can develop post-strep glomerulonephritis. The strep bacteria travels to the kidneys and makes the filtering units of the kidneys inflamed, causing the kidneys to be unable or less able to fill and filter urine. This can develop 1 to 2 weeks after an untreated throat infection or 3 to 4 weeks after an untreated skin infection. We need to find balance, and here's what I want you to understand. Questioning the medical establishment and developing health literacy doesn't mean rejecting all medical interventions. It means developing the wisdom to know when they're necessary and life-saving versus when they're unnecessary and potentially harmful. When I see patients with confirmed Lyme disease, serious strep infections, or life-threatening conditions like C. diff, I don't hesitate to recommend appropriate therapy, but I also work to support their overall health, address root causes, protect and restore their gut microbiome, and help them recover their natural resilience. The goal isn't to avoid all medical interventions. It's to use them wisely when truly needed, while simultaneously supporting your body's inherent healing capacity and addressing the lifestyle factors that created the vulnerability in the first place. All of this can be extremely overwhelming, and it can be frightening to understand or learn. But remember, the power that you have is knowledge. The more you learn about what's actually happening in your health, in understanding nutrition, in learning what your body wants to be fed and how it feels, and working with practitioners who are holistic in nature, natural, integrative, functional, whatever we want to call that these days, the more you can learn from them, the more control you have over your own health. And what I would urge you to do is to teach your children what you're learning. Teach them how to live a healthy lifestyle. Teach them how to keep a clean environment. This is how we take back our own health. So thank you for joining me today on Let's Talk Wellness Now. If this episode resonated with you, please share it with someone who could benefit from understanding how the Rockefeller medical system has shaped our approach to health and how to reclaim your body's wisdom while using medical care appropriately when truly needed. Remember, wellness isn't just about feeling good. It's about understanding your body, trusting its wisdom, supporting its natural healing capacity, and knowing when to seek appropriate medical intervention. If you're ready to explore how functional medicine can help you develop this deeper health knowledge while addressing root causes rather than just managing symptoms, you can get more information from serenityhealthcarecenter.com or reach out directly to us through our social media channels. Until next time, I'm Dr. Deb, reminding you that your body is your wisest teacher. Learn to listen, trust the process, use medical care wisely when needed, and take care of your body, mind, and spirit. Be well, and we'll see you on the next episode.
Welcome to Let's Talk Wellness Now, where we bring expert insights directly to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult with a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcast. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised.